Hello, everyone, and welcome to today's podcast, The Importance of Proper Robotic Instrument Reprocessing and Sterile Processing. My name is Shanita, and today I will discuss why proper cleaning, inspection, and maintenance of robotic surgical instruments are critical to patient safety and successful surgical outcomes. Robotic assisted surgery has become increasingly common in hospitals around the world. These advanced systems allow surgeons to perform procedures with greater precision, smaller incisions, and often faster patient recovery times. However, the sophisticated instruments used during robotic procedures require specialized care after every use. My thesis for today's podcast is that proper reprocessing of robotic surgical instruments is essential for preventing infections, maintaining instrument functionality, reducing healthcare costs, and ensuring patient safety. Throughout this discussion, I will explain the challenges associated with robotic instrumentation, the risks of improper reprocessing, and the best practices sterile processing professionals can follow to ensure these instruments remain safe and effective for surgical use. First topic is going to be understanding robotic surgical instrumentation. Now, before discussing reprocessing, it is important to understand what robotic surgical instruments are. Robotic surgical systems, such as the widely used Da Vinci surgical system, consist of robotic arms, specialized instruments, and computer technology that assist surgeons during procedures. Unlike traditional surgical instruments, robotic instruments contain delicate joints, articulating wrist mechanics, electrical components, fine cables, complex internal chambers. Now, these intricate designs allow surgeons to perform highly precise movements inside the patient's body. However, the same features that make robotic instruments effective also make them challenging to clean and sterilize. Even small amounts of contained soil, blood, tissue, and debris can interfere with instruments' performance or create opportunities for growth. As robotic surgery continues to expand into specialties such as neurology, general surgery, and cardiothoracic surgery, sterile processing professionals play an increasingly important role in supporting patient care. Now, let's talk about the importance of proper reprocessing. Proper reprocessing includes several steps, amongst many more, just to name a few: point of use treatment, transportation, cleaning, inspection, testing, packaging, sterilization, and storage. Each step must be completed correctly to ensure patient safety. The primary goal here of reprocessing is to eliminate microorganisms and remove all visible and invisible contaminants from the instruments. According to the Centers of Disease Control and Prevention, inadequate cleaning can compromise the effectiveness of sterilization and increase the risk of healthcare associated. Okay, so cleaning is often considered the most important step because sterilization cannot reliably penetrate heavy soil or organic materials left on an instrument. Now, when robotic instruments are not properly cleaned, patient safety can be placed at risk through contamination, infection, instrument malfunction, and surgical delays. Some of those challenges associated with robotic instruments are complex designs, which means the hinges, the lumens, internal mechanisms, moving parts, amongst many others. Now, let's see here. Another thing that is also affected is limited instrument life. Another challenge is that robotic instruments have limited use cycles. Many robotic instruments are programmed with a maximum number of use. Bet you guys didn't know that. Now, many robotic instruments, once again, they're programming with maximum numbers of use before retirement. For example, an instrument may only be approved for 10 uses. Sterile processing technicians must carefully inspect and track instruments usage to ensure expired instruments are removed from service. Failure to monitor usage limits could result in equipment failure during surgery, which is never a good thing. We also have to consider the cost. Robotic instruments are expensive. Individual instruments may cost hundreds or even thousands of dollars, and proper handling, cleaning, or inspections can shorten instrument lifespan and increase replacement costs for healthcare facilities. Therefore, proper reprocessing protects both patient safety and organizational resources. Now, if you decide not to do it thoroughly and properly, some of the risks of improper processing is that when robotic instruments are improperly reprocessed, serious consequences can occur. Some of them requires the patients may require additional surgeries, extended hospital stays, increased healthcare costs, delayed recovery, and patient suffering. Instrument malfunctioning, which is never good in the case of surgery, because when the instruments do malfunction, it loses the precision, it fails during the surgery, and it causes procedure delays. In some cases, surgeons may need even to convert robotic procedures to traditional open surgery, increasing the patient's risk and recovery time. Some things to make sure that we do mention is the financial impact. Healthcare facilities can experience significant financial losses from damaged instruments, replacing the cost of the instruments, canceled procedure, and liability concerns. Preventing these issues begin with effective sterile processing practices. Some of the best practices is to simply follow manufacturer instructions. The most important recommendation is to strictly follow manufacturer's instructions for use, commonly known as IFUs. Each robotic instrument has specific cleaning and sterilization requirements. Technicians should never assume that one robotic instrument can be processed the same way as another. Following the IFUs helps ensure consistent and safe outcomes. Immediate point of use care has to be followed. The point of use cleaning begins immediately after surgery. The gross soils should be removed before instruments dry. Dried blood and tissue become much more difficult to remove and may interfere with cleaning effectiveness. Prompt treatment improves cleaning success and protects instruments' integrity. Throughout the inspection should be focused on cleanliness, cracks, corrosion, broken insulation, damaged joints, along with missing components. Any instrument showing signs of damage should be removed from service and evaluated for repair. Self education should continuously be ongoing. New instruments are designed each year. The IFUs are updated. The industry standards change. Emerging best practices is constantly on ongoing and changing. So we do have to be mindful of that. Now, in conclusion, robotic surgery instruments are highly advanced devices that require specialized cleaning, inspection, testing, and sterilization procedures. Improper reprocessing can lead to infections, as we know, instrument failure, as we know, increased healthcare costs, and patient harm. The most effective solution includes following manufacturer instructions, performing immediate point of use care, conducting thorough inspections, testing instruments functionality, maintaining ongoing staff education is always the best way to go here. Now, my central argument for today has been that proper robotic instrument reprocessing is essential for patient safety, instrument longevity, and surgical success. As a robotic surgery continues to expand, sterile processing professionals will remain a critical part of the healthcare team. Their commitment to quality and attention to detail directly impacts every patient who enters the operating room. Once again, I want to thank you all for listening to the importance of proper robotic instrument reprocessing and sterile processing. I hope this discussion has provided valuable insight into the important role of sterile processing professionals that it play in modern healthcare. Stay committed to excellence, continue learning, and remember that every instrument processed correctly contributes to safer patient care.